Hi, my name is Sarah Allen and I'm part of the Vet Compass team. Vet Compass is an RVC-led research programme which takes large volumes of veterinary electronic patient record data and converts it into robust population statistics relating to animal health and patient care. Equine Vet Compass is still a relatively new project, and with this study we wanted to explore what could be learnt about a common equine disorder using data only recorded within veterinary electronic patient records, and the condition we chose to investigate was wounds. This work was funded by the RVC Mellon Fund for Equine Research and RCVS Knowledge. Ethical approval was granted by the RVC's Clinical Research and Ethical Review Board. The aims and methods of the Vet Compass programme have also been reviewed by the Royal College of Veterinary Surgeons. They concluded that as no owner or animal identifying data are collected, and with the project being in the public's interest and not for commercial gain, it is acceptable for Vet Compass to operate under an opt-out policy for owner consent. Owner consent for data sharing is therefore given by default. However, collaborating veterinary practices must promote their involvement in the Vet Compass programme, and there is an opt-out function for owners not wanting to share their data. This work would not have been possible without the support of the RVC IT team, Eclipse Veterinary Software and the collaborating practices, and I'm incredibly grateful to all of them for their contributions to this project. The first equine Vet Compass study reported on disorder prevalence and identified wounds as the second most common reason for veterinary attendance, with a prevalence of 5.6%. Wound-related activities have also been reported to account for 25% of caseload in equine practice. Despite wounds being common, there is limited information describing their presentation, management and outcomes, and little work has been done to evaluate risk factors for their occurrence. Veterinary electronic patient records pose a potentially valuable source of clinical information which can be used to fill these knowledge gaps. The objectives of this study were to estimate wound prevalence, describe the clinical presentation, management and outcome of wounds, and explore risk factors for their occurrence in a cohort of veterinary attended horses and ponies. Anonymised veterinary patient record data were collected from a convenience sample of 5 UK equine veterinary practices using the bespoke Vet Compass data capture system. A study population was created of all horses and ponies attended over a 12-month period. External referrals and racing thoroughbreds were excluded to allow for better generalisability of findings to the general horse population. Potential wounded horses were identified using a series of electronic keyword searches. The clinical record for each potential case was then read through the Vet Compass clinical coding app to confirm wound status and extract additional information on presentation, management and outcomes. Wound prevalence and its associated 95% confidence interval was calculated using standard methods. Clinical factors, treatment and complications were reported using basic descriptive statistics. 2 nested case control studies were set up to explore potential risk factors for wound event. All study horses were eligible for the first model, however the second was restricted to those with complete demographic information available. A 1:2 case controlled ratio was used and a horse could only appear once in a model. For the cases, a wound event was selected at random for each wounded horse identified during the study period. Control events were approximated for non-wounded horses and then chosen at random. Sample size calculations estimated that a minimum of 669 wound events would be required to detect an odds ratio of 1.5 or more with 80% power and at a 95% confidence interval. Risk factors were evaluated using mixed effects, multivariable logistic regression, with veterinary practice ID included as a random effect throughout. A total of 25,693 horses and ponies were attended over the study period. Of the 3,957 potentially wounded animals identified, wounds were confirmed in 1,363, which equates to a prevalence of 5.3%. A total of 1,444 individual wound events, with a maximum number of events per horse being 4. The most commonly recorded piece of information regarding clinical presentation was location, and this was available for 95.3% of events. In keeping with previous work, the distal limb was the most common site of injury, with 41% of wounds occurring in this region. An estimated wound age was documented for 12% of events. Where available, the median age at first veterinary examination was 24 hours, but ranged from minutes to several months. The majority of wound events were treated at the yard, with only 7% referred for further assessment and management. Systemic antimicrobials were prescribed in 79.5% of events, with the most commonly prescribed classes being trimethoprim sulfonamides, tetracyclines, and penicillin. Highest priority, critically important antimicrobials were used in 3.5% of events. Standard bandages were applied in 31.1% of events, with bandage casts in 0.6%. Primary wound closure was performed in 20.8% of events, with delayed closure an additional 0.1. The most commonly employed imaging modality was radiography, and this was used in 9.4% of events. The reported complications are summarised to the right of the screen, with cellulitis, exuberant granulation tissue, and wound breakdown the most common. Death unfortunately occurred in 2% of events. Similar patterns of association were seen in both risk factor models. The odds of wound event were 40% higher in summer compared to winter. This seasonal distance was expected, as previously it has been observed that wounds most commonly occur during periods of turnout. Age was categorised based on rounded quartiles, and horses in the oldest age group had a 40% reduction in the odds of wound event compared to those in the youngest group. Older horses may be less prone to injury, as their previous experience may make them more settled in their surroundings and less inquisitive. Breed differences were also observed, with draft breeds, cobs, and Welsh ponies all having lower odds of wound events compared to thoroughbreds. The quality of record keeping was a major limiting factor in this study. Full demographic information was unavailable for 53.9% of the study population, and it is difficult to determine what bias this may have introduced. The recording of clinical details was also extremely variable, and full information regarding the location, size, shape, and reason for the wound was rarely reported. More detailed and standardised recording of clinical cases would allow for more in-depth descriptive and risk factor analysis. This study likely underestimated wound prevalence, as not all owners will seek veterinary attention for a wound, especially in the case of minor injury, and care is also needed in applying these findings to the wider horse population, as no information was obtained on the non-veterinary attended horse population. Risk factor analysis was restricted to the available information within the clinical record. Supplementary collection of information regarding modifiable risk factors, such as field size, fencing type, and other management practices, would be beneficial for future work. This study only used data from a small convenient sample of veterinary practices, and further work would benefit from the inclusion of a greater number and a broader range of veterinary clinics. To conclude, wounds are a common problem and most often involve the distal limb and are without serious consequence. Wounds were less common in older horses and more docile breeds, and more common in summer. Further work would benefit from improved record keeping and supplementary data collection. That brings me to the end of this presentation. I'm happy to answer any questions you have. If you just add them to the forum, I'll get back to you as soon as possible. Thank you.